Hello everyone, you are all welcome to lecture number 1160, and today's topic is calcium channel blocker. They are the group of drugs which are used to lower the blood pressure, high blood pressure, and also cardiologists they are using to treat the angina. If I say angina means it is a type of pain in left hand because of the narrowing of the arteries, and in that case the blood flow will be very slow. Because of that reason we get pain. That pain is called angina. And this calcium channel blockers, here calcium is very important, and these drugs they work to stop or to reduce the amount of calcium in our arteries, blood, and even going to heart. And nowadays there is important test to understand the calcium status of our body. If in case in our blood circulation there is excess of flow of calcium, it indicates that we are having some problem, or we may be having some problem of blood pressure, and also some squeezing of our arteries and heart muscles. So that's why nowadays there are a lot of calcium channel blocker drugs in different names that I will be mentioning later on. So it is very important for all of us to understand the role of these drugs. And there are another two drugs, they are known as beta blocker, alpha blocker, and they are all responsible of the same type of action. The only thing is that this calcium blocker is very specific for the blocking of the calcium flow in our arteries, so that our arteries they are not narrow, and secondly the blood flow is clear, and also if the calcium is blocked, it's not going much in quantity, our heart will not sink. Otherwise the deteriorating condition or sinking of heart and arteries they are serious. It means that our cardiovascular system is deteriorated day by day if the calcium flow is not blocked. That is the exact meaning of calcium that is blocker, channel blocker. And the other drugs like beta and alpha blockers, actually they are responsible of changing the physiology, means the hormone. They are treated as a drug for cardioactive condition, means your muscle, cardiac muscle means heart muscles will be activated, will be toned by taking alpha beta blockers. And such group of drugs are known as cardioactive drug like digitoxin. So there are these different type of drugs. Out of all these drugs, the most popular and common type, that is called calcium channel blockers. And there are a lot of publications nowadays. One of the research paper from Washington, USA, they have mentioned in that publication that those who are keeping on the long run with this calcium channel blocker, actually calcium channel blocker drugs, there are three categories. One is called short action, then intermediate action, and the long action. So in that research paper they have mentioned that those who are taking short term action, that is calcium channel blockers, they have chance of 58 to 70% of cardiac problem, means heart attack. And they have recommended that rather than going for calcium channel blocker drugs, they should prefer to go for diuretic drug. Diuretic drug means they are such type of drugs that they will remove the extra retention of water in our body. And these drugs are also commonly called globally, that is called water drug. Water drug means there are different type of preparations and they are responsible of reducing the extra retention of water in our body from this kidney. Kidney is filtering, and in that case, with that drug, the blood pressure will be reduced, because the retention of water is causing also for our arteries to squeeze, and because of that the blood pressure is there. So that, and secondly, by excretion of more water, urination will reduce some toxic salts also. Salts are also reduced, even some salts which may be retained in kidney. So your kidney will also be in good condition, as well as your heart muscles and arteries. So these are all very, very important role of calcium channel blockers, beta blockers, alpha blockers. Also, one thing let me mention, in one of the research paper it is mentioned that we have this calcium channel blocker in natural form. So there are some vegetable and fruits, they are rich source of magnesium, and magnesium is the best natural source of calcium blocker. And I think the richest source of magnesium is that is we call it in pumpkin. In Indian language we call it kaddu, and its seed. And it is very common, I have seen in New York and Washington, that yellow pumpkin is sold and they are preparing lot of food out of it, and like that some other vegetables. So if you are regularly taking, it will not allow such type of calcium flow, and it will block. And also there are some papers where they are mentioning that if we are reducing drastically intake of fat, saturated fat, trans fat, partial hydrogenated fat, means they are such type of group of fats, means like in India we call it dalda. Dalda is nothing but when the liquid good natural vegetable oil, by hydrogenation, by adding some molecule of hydrogen, all the unsaturation double bond is converted into single bond and it will become solid at room temperature. So if such type of fat you are taking in excess, you are towards high blood pressure. But if you drastically reduce and go for olive oil and also mustard oil, sarso ka tel, we can substitute olive oil with our sarso ka tel, means Indian language, and here in English we can say mustard oil. Only difference in this that is monounsaturated omega-3 oil, that is your olive oil, zaitun ka tel, is that only CS group is there in mustard oil. Because of that there is fuming of this a particular peculiar smell is there in mustard oil. Otherwise their chemistry is same, they are unsaturated, monounsaturated fatty acid, liquid at room temperature. And in India, in every kitchen, I am talking of UP and Delhi, North India, no kitchen is without sarso ka tel. And that mustard oil is treated as one of the best cooking oil, and also for medicinal purpose. In the morning, they will just massage with the mustard oil. They will sit in the sunlight. In our childhood, we used to practice this, and then we will take bath. It's the best way to have very good, we can say, stretching property or elasticity of our muscles, and even it is good for our circulatory system. So they have mentioned in the research paper that if you are reducing drastically the intake of saturated fat, hydrogenated fat, you can lower down your blood pressure and also reduce crystalline refined white sugar. I boldly, as a chemist, call sugar is white poison. And believe me, after going through a lot of research papers, this is my conclusion why I am calling it is a white poison, and why 1.4 billion Indians they are suffering from diabetic condition is because of our sweet culture. Sweet culture means everything starts, every celebration or happiness or marriage or getting success is celebrated with sweet. Muh meetha karo. Please get the sweet and eat. That culture is killing us. And we are maximum user of sweetening agent that is sugar. So please stop sugar. Sugar, I can call it mother of all metabolic problem, disease, cancer, even your eye, glaucoma, that's eye disease, is because of excess sugar. Your brain problem, your cancer is all related in the long run because I'm discussing of the latest research papers. They are not related to sugar. Sugar is the best feeder for cancer cells. Anybody who is having any tendency of cancerous cell, first condition is stop sugar. If you are taking any amount of sugar, means your body is becoming acidic, and we should have alkaline. That is one of the factors. Sugar is insomnia, sleepless night. So it is linked to diabetic, insomnia, glaucoma, blood pressure. That's why I call it sugar is the mother of lot of metabolic disorder and lot of disease. This is my, as a professor of medicinal chemist, after reading lot of research papers today in 2023, is my observation. So once you stop the sugar, also sugar is reducing your immune system. And I'm free to mention one thing that is called addiction. One is where something is necessary, then you are taking, is not addiction, it is needed. Addiction means where you don't need, but you will go on taking. In India, there are different type of addicted people, even in Nigeria. But in Nigeria, it's very nice, I know. They are not sweet loving, they are not sugar loving, but still, lot of sugar is consumed in different preparation. So in India, this the sugar is the part of our life, and this addiction I am just mentioning. In India, people are smoker, chain smoker, alcoholic, lot of drug, cocaine, heroin, all together. They are not putting that much harm. Rather than, I call them sugar addicted people. If you are sugar addicted, it's a serious issue. That's why India is known as the country of diabetes. India is known as the country of cardiovascular problem. If you check all the lifestyle, we are consuming a lot of adulterated sweet preparation, derivatives. That is killing our country, and it is applicable to every country. So this is what is my observation, and I am going to give one by one. So here I am showing the calcium channel blocker drug and its effect. You see on top where there is percentage of calcium is more, so calcium is blocking. And the second one, where some people who are keeping on calcium blocker drugs, that is called calcium channel drugs, and then their arteries and all those are relaxed, and there is enough passage to pass on so that they can get. And secondly, the heart is shown, which is sink. So this is the condition of the heart and circulatory system, and where it is needed to have calcium channel blocker, because of the excess of calcium flow in the blood has deteriorated the condition of cardiovascular system. So I have given here the summary of very, very interesting research papers, what I have abstracted from those publications. So number one, calcium channel blockers, commonly they give in books or journal CCBs, means CCBs stands for calcium channel blocker. S means lot of group of medicines, are medicines used to lower blood pressure. They stop calcium. Calciums usually in our body are in the ionic form, that is calcium 2 plus, from entering the cells of the heart and arteries. Calcium causes the heart and arteries to squeeze and reduce the size of the heart, and also make the arteries narrow more strongly. Number two, by blocking calcium, the calcium channel blockers allow blood vessels relax and open. Magnesium, that is Mg, lowers blood pressure is by acting like a natural calcium channel blocker. Number three, CCBs means calcium channel blockers are a group of medicines commonly prescribed by the doctors to treat conditions like heart and blood vessels, such as hypertension, that is high blood pressure, angina, commonly called as angina pain due to narrowing of the arteries, and some RAMs, and that RAM is called Raynaud's phenomenon. Raynaud's phenomenon is a very serious phenomenon. RAM is pause of your muscles, of your toe, of your fingernail is having stiffness, sometimes numbness, coldness. Even at the age of 70 now, I am getting sometimes. It happens to me, but immediately I will just do some stretching exercise. I am taking care and I am managing. And this Raynaud type of, that is RAM, symptom is very common to those who are suffering from sugar problem. I call it sugar problem, not diabetic. Means extra sugar is flowing in their blood, that is called diabetic condition, is very common for those ones. That is called Raynaud's phenomenon, a condition resulting painful and cold fingers and toes may be due to narrowing of arteries in the hands and feet. Actually, your all conditions, everything in normal ways, without spasm, without all this coldness, numbness, if there is blood flow, circulation of the blood reaching from toe to all body, you are okay. The problem starts from blood circulation, because once your body, any part, if it is not receiving nutrient and oxygen, there will be numbness, there will be spasm, and there will be pain. So your blood circulation is very, very important, and your blood viscosity, blood pH, blood calcium, the whole chemistry of blood is very important. That's why I say that if in your blood sugar is more, it's metabolic disorder, everything will be shattered and a serious condition. Sugar is the mother of all problem. Fingers and toes due to narrowing of the arteries in the hands and feet. Doctors may prescribe CCBs, that is calcium channel blockers, or if you have angina or high blood pressure. If three conditions you have, either angina or high blood pressure, or if you have that is cold fingers, doctors, physicians will prescribe, that is your CCBs medicines. Number 4, two drugs are very common. First is called dihydropyridines. Dihydropyridines, they are sold in the name of one is that is nifedipine, and the second one is amlodipine. So nifedipine, amlodipine, they are calcium blocker drugs and very common in the market. The second one, that is non-dihydropyridines, and these non-dihydropyridines are sold in the name of dilatazine and verapamil. So these are all drugs very common. Both these CBS drugs help to relax and widen the arteries. So here number 5. Recently, Bruce Pastley, that is University of Washington, USA in Seattle. Seattle is a place and there is a big university and they have a lot of research. Research papers reports that CCBS users are 50% to 70% more likely to suffer heart attacks than people who take just diuretics. What is diuretics here? Diuretic is any substance that promote diuresis. Diuresis means the increased production of urine, and diuretics tablets are called water tablet, and these drugs, those diuretic tablets, they can remove all the water which are retained in your body, and because of that you have blood pressure. So that is called diuretic drugs, and therefore the Joint National Committee on Direction, Evaluation and Treatment of High Blood Pressure in USA recommends the first treatment of beta blockers and diuretics. So recently that committee, that is evaluation, direction and treatment of blood pressure in America, they are recommending that if anybody who is having such condition like blood pressure or hypertension, they should be treated first by beta blocker or diuretic type of, that is water drug, rather than going for this that is calcium channel blockers. But there is reservation. This beta blocker, it is sensitive to your trachea, the pipe, and it will be congested. There will be congestion and suffocation. So in that condition, if someone is having some lung disease or very poor lung condition, it is not recommended. Or somebody who is heavy smoker for a long time is not recommended. That is beta blocker. In that circumstance, one should go for calcium channel blocker. So that is weak lungs conditions, because beta blockers can block the bronchial tubes, and if this drug is not effective, only then we should go for calcium channel blockers, that is CCBS, is the only choice. Number 6, an editorial in the same journal recommends that patients taking calcium channel blockers include, these are drugs they have mentioned, they are all that is calcium channel blockers. One is Adalat, second is Kalan, Cardizem, Delacor, Isoptine, Procardia and Verilon. These are all calcium channel blockers, and they may sell in different trade names, commercial name, or in lot of marketing is there in pharmaceutical industries, but these are all main constituent, And the beta blockers, they include beta phase, glucagon, Brivloc, Catrol, Cargar, Inderal, Kerlone, Levetol, Lopressor, and Sectral and Stenoromine. So these are the drugs, main drugs globally are for beta blocker, and I have already told you the difference in calcium and beta blocker. Calcium blocker, channel blocker is targeting calcium to not to allow to enter in the arteries and cardiac muscles. But beta blockers, they are targeting the hormone secretion, and on that basis they are working. Number 7, previous studies show that more than 60% of adult hypertensive, means those who are suffering from high blood pressure, can have their blood pressure return to normal just by going on a low fat, very low fat or unsaturated fat, and intake of sugar very, very less or almost, actually it should be zero. To my understanding, the sugar is the mother of all problem. So with this, I will stop. And this lecture is very much related to your cardiovascular system, means your heart and blood circulation. And I have gone through a lot of papers, and this is the summary of all the research papers today in circulation. Once again, thank you very much for watching the lecture.